All right, hi everybody. Hope you are enjoying the nice spring weather. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. We are discussing slipped disc symptoms. So right off the bat, we're going to go into what is a slipped disc. So there's a lot of words for what occurs in your back when it comes to your disc. You have herniation, you have bulging, you have slipped, and we've used these interchangeably, and unfortunately, even in the medical profession, they've come to all mean the same thing. We don't use the word slipped too much anymore. Usually it's more herniated or bulging. Now, there are specific measurements if you were to go into the nitty-gritty of the difference between bulging and herniated. There are millimeters that actually matter when you're naming those things, but in all reality, when we get a script from a doctor, the word slipped is generally not on there, but slipped means the same thing as herniated or bulging. We know we're looking at some issue going on with the disc. So slipped, herniated, bulging, what are the symptoms? So when you're talking about any sort of disc problem, and this is where a lot of therapies fail because they don't address everything going on. Now, I'm going to say right now that 80% of all Americans have some sort of disc issue. Is it herniated? Is it bulging? I think I've got like 5 in my back. I have no back pain, but because of whatever, my discs are bulging. So it's very common to have a herniated or a bulging or a slipped disc. It's very common for you to have back pain, go in for an MRI and say, oh, eureka, it's a slipped disc or a herniated disc. Unfortunately, most of the time that has nothing to do with your pain, but because a lot of times the pain is coming from muscle imbalance or an SI joint dysfunction, there are just and there's no real way to have that show up on an MRI or X-ray. It's just easier to say, oh, you have back pain, must be coming from this disc that we saw right here on this MRI. That's bulging. So always be careful of a diagnosis of a bulging or herniated or slipped disc because it doesn't always mean that's what causes your pain. Now, a lot of times, especially when we're talking about disc issues, we find that there are several issues going on and several issues at play. So when you're talking about getting rid of the pain caused by a slipped or herniated disc, we are talking about going at a multifaceted approach, and many times this multifaceted approach isn't done. So you wind up with not having the most successful therapies. But what are some symptoms that you can have when you're talking about a disc? So normally a disc issue is going to affect the nerve. So the nerve is running down your spine. It's going near the disc, and if that disc is pushing against that nerve, it's going to cause some irritation. So nerve pain is generally defined as numbness, burning, or tingling. Those are the 3 words that we associate with a nerve. So if your leg is going numb, or you're burning into your thigh, burning or numbness and tingling in your foot, those are all symptoms of nerve involvement. And those are all symptoms that can be associated with a herniated disc. Now, because you wind up with some complications in terms of you wind up with a herniated disc that you may compensate for, therefore you may have some issues that are now being, that numbness and tingling or that burning sensation is going to be caused by some muscle tissue. Also, you really don't want to just accredit that numbness, tingling, burning, whatever you want to call it. You don't want to just blame that on the disc being herniated or disc bulging. It's super important that you break down exactly where it's coming from. Another issue that you may have is weakness, and this is when this has really progressed to some sort of issue that you can't deny anymore. When we're talking about legs, we're going to see more of a foot drop. So are you tripping going up the steps? Are you tripping going up a hill? That's more of you can't lift your foot up. That's a nerve involvement, generally coming from that back, generally coming from some disc involvement. If you're talking about more of a slip disc or a bulging disc in your neck, you're talking more about not being able to even hold something like a coffee cup or write your name. That sort of fine motor skill those fine motor skills disappearing. So that's a very severe case, and unfortunately people do allow it to get that far because it doesn't take a whole lot for that numbness and tingling to turn into that weakness. Unfortunately, sometimes you don't even have the numbness and tingling. You go right towards that, you go right to the weakness, and that's when we really have some issues, because that, if you don't get it treated, it can be permanent. Another issue can be pain. Usually though, pain is more of that burning, which can cause the pain. You're going to find that the pain associated with the disc generally will shoot down either one or both of your legs. So you need to be aware of that. It can go as far as your feet, or it can go into your hips, into your groin, your thighs, but there's pain there. It can be just centralized in your back and not really go anywhere. But you really will have some sort of pain. And again, is that pain caused solely from the disc, or is that pain caused from more compensation? That's something we would have to see in treatment. So those are really some of the big symptoms that you're going to have with that herniated disc. Now those symptoms may cause you not be able to sleep, not be able to sit down, not be able to stand for long periods of time. There are different results and different things that can happen when you have those types of issues going on, but those are the three big symptoms that I would say you really would encounter when you have a bulging disc. Now, when you have a bulging or a herniated or slipped disc, posture is super important. How you sit, how you bend over, how you stand, really, really important to minimize that disc bulging or slipping any further than it already is. You can check out our YouTube channel, Total Performance Physical Therapy, that has a ton of videos on posture, but it's really important that you understand that one of the first things you can do immediately before you see anybody is fix your posture. Get your posture corrected. Sit correctly at the computer, stand, make sure you're sleeping correctly. That's going to help minimize that slip disc. That's the best way. Beyond any exercises, it doesn't matter the exercises you do. If you don't fix your posture, you're not going to save that disc from slipping any further. If you or someone you know is suffering with a herniated, bulging, or slipped disc and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.